We want to thank you for joining us today. I'm Mayor Robert Garcia. I'm here with our fire chief and also with Dr. Davis from the health department. We are going to be giving an update today on a lot of information, some serious information, but also translate some of that into Spanish. And towards the end, we're going to answer questions that some of the media have submitted. So we want to make sure that we're able to do all of that. And so if you're watching, this is a community briefing for the city of Long Beach and for the Long Beach media as it relates to COVID-19. And I am joined again by our fire chief, who's going to say some remarks right after me, and then we're going to turn to Dr. Davis. We all know that we are in a very serious public health emergency that is not just affecting the city of Long Beach, but is affecting the entire country and the world. We know that this has been called a global pandemic, and we do know that some of the best scientists and doctors from across the world are really working together to solve this enormous challenge that we have in front of us as a city and as a community. We have been reporting from the start of this every time we've had a new person that has tested positive for COVID-19. We've been consistent, and we believe that it's important for us as a city to share all information as soon as we have it to you and to the entire public. It's important for public agencies and the government and for you to know that we are being fully transparent in all the information that we share, and that you're getting it timely when we learn it and then getting it out to all of you. And so I do want to thank those that have been watching these community updates and sharing them as well. You may know that yesterday evening, and this started happening late in the evening, we received confirmation that 8 of our very own Long Beach firefighters were tested positive for coronavirus or COVID-19. As you can imagine, this has been devastating news for us here as a city and for our entire community. Long Beach firefighters are some of the best firefighters in the entire country. We love our fire department. Personally knowing many of the men and women that serve us, they work incredibly hard every single day to respond not just to fires, but medical emergencies, issues around safety, and they have been actively responding to issues around COVID-19 as well. And so we did have last night 8 firefighters test positive. I want people to know that obviously we are testing additional firefighters beyond those 8, and so that number could go up. But it is important for us to realize that this is a significant number, and it's serious, and we're taking it very seriously. I am relieved to report that the firefighters are in good spirits. They're being well taken care of. We are doing everything we can within our own health department, but of course our medical community, to make sure that the firefighters and their families have all the support that they need to recover and get better. And I ask you to join me in supporting them, in praying for them, in sending them love, as they're going to need the support in the weeks ahead. I want to share a few things. First is that of the 8 firefighters that tested positive, 4 of these firefighters are residents of Long Beach. And so 4 are residents, and we'll count, and within our Long Beach count, the other 4 firefighters who are residents of other cities will then be counted in those individual cities in the counts that they report up through the state and to the CDC. And that is how all jurisdictions are doing this across the state. I can share that these firefighters were part of Station 11. Station 11, which is on Market Street, is in North Long Beach. So this was a North Long Beach fire station. This is, many in the community know this station well. I know this station. I've been to this station in the past. So we know the men and women that work here, and it's really tragic what we're facing. I want people to also know that the total number, when you add the firefighters that live within Long Beach, our total number of positive COVID-19 cases is now at 41. And if you think that number sounds high and higher than it was just a day or two ago, it's because it is exponentially increasing day to day. This is something that you're seeing across the county, the state, and the country. If we do not flatten the curve immediately, this number will continue to increase and exponentially grow over time. And so you can also expect that that number of 41 will continue to increase exponentially, possibly. And also note that, once again, I want to remind everyone that just because we have 41 positive cases does not mean that there are not more or many more individuals that currently are positive for COVID-19 that are within our community. I again ask the public to please consider, you should act and behave like anyone around you could have COVID-19. And that is the best way to protect yourself, your family, and to not burden the immense hospital and medical challenges that we have ahead in the next few weeks, as we know this curve will begin to climb. And so I'm letting folks know that this is a serious public health emergency and people need to take it seriously. I have some other announcements as it relates to our city response, but to speak specifically on the firefighters and this challenge itself, I want to have our Fire Chief, Javier Espino, say a few words now. He will also answer some questions later. And of course, our love and our hearts are with the entire fire department. So, Chief.
Thank you, Mayor Garcia. As the mayor stated last night, tragically, we were notified that we had 8 firefighters that tested positive for COVID-19. The initial report was 5, quickly followed by another 3. And as you can imagine, it was devastating to us, both as a fire department and to our city family. I want to reassure the community, all 8 are at home and they are resting and in good spirits. The Long Beach Department of Health and Human Services is actively investigating the details surrounding these cases, as well as any other potential exposures. And at this time, the preliminary investigation indicates that the firefighters were exposed to the virus during the performance of their regular duties. I want to reassure you that the Long Beach Fire Department is continuing to take extensive precautions to safeguard fellow first responders, as well as the public with whom we interact. We're working closely with the health department to minimize further risk to other public safety personnel. We have been and will continue to follow all protocols set in place from the city manager's proclamation of local emergency, as well as public health guidance from the health department. We will continue to provide the necessary support to our personnel and their families as we move forward. We will work through these challenges. The city's public health efforts will continue to focus on containing the spread of the virus and mitigating the impact of COVID-19 on the community. The city will continue to prioritize older adults and people with severe chronic medical conditions in an effort to prevent the spread of the virus and protect our most vulnerable population. While the ratification of the city manager's proclamation of local emergency will continue to provide us with the accelerated accrual of resources necessary to successfully wage this war on COVID-19, I'd like to emphasize the impact of the community's role in preventing the spread of this illness. I can't stress enough how important it is for everyone in our community to respect the safer at home mandate and practice impeccable personal hygiene and social distancing. The likelihood of death from COVID-19 continues to remain relatively low for most people. However, all precautions should be taken to avoid its spread to others. Everyone can stay informed by visiting www.longbeach.gov/COVID-19 for updates related to the state of COVID-19 in our city. Follow @LongBeachCity on Facebook, Twitter, and Instagram. The city has also established an info line for questions related to COVID-19. That number is 562-570-4636. Thank you, Mayor.
Thank you, Chief. And as you can imagine, our firefighters are our community heroes. And please have your thoughts and your love for these 8 firefighters And again, tragically, we expect there could be more as well, and we'll report that as soon as we know and we get the results. I want to just reemphasize something that the fire chief said, is that our firefighters, and this includes also police officers, medical personnel, they're out there every single day picking up the phone when 911 is being called, when they see an emergency, or when people need help. And during this time, more and more people are calling, asking for help around questions around COVID-19, but also just the regular calls that happen every day. Please note that as a city, we're not only responding to the COVID-19 outbreak, we are responding to the daily calls that happen on a regular basis that you would have called in before the outbreak happened. And so the amount of work that our firefighters and police officers are doing right now is immense. And you can help that work, and you can help our heroes, our firefighters, our medical personnel, our police officers by following the city and the state's mandated safer at home orders. And I want to review a couple key points. Number one, and most importantly, if you do not need to leave your home, if it's not essential, please stay at home. This protects you, your family, the community, and our safety officers. Remember that essential activities that you have to do to keep yourself healthy, your family, your pets, you can do, but those are essential only. You can go out for a walk if you must. You can walk your dog. You can go get a little exercise by taking a run outside. But beyond those activities and going to the grocery store or picking up food, and unless you're working at an essential place of business as mandated by the governor and the city, we're asking you to please stay home and help us flatten that curve. Additionally, we ask people, even when you are with other folks outside or you're interacting in the grocery store or at work, to keep 6 feet of distance from every other person to maintain social distancing, and of course, avoid touching other objects, wash your hands for 20 seconds, try not to touch your face, and if you're feeling even just a little sick, stay home and call your doctor. Your doctor will give you advice. Please stay home. We've made a couple new amendments to our stay-at-home order as well. We noted just yesterday that we have also now closed, besides all of our sports courts, golf courses, basketball courts, tennis courts, skate parks. We have also now closed parking lots adjacent to parks, most of them, and beach parking lots and the pier. And why did we do that? We had to do that because too many individuals are still outside congregating in groups and being, quite frankly, not just unhealthy, quite frankly, also irresponsible, but also that type of behavior is not allowing the city and our firefighters to do their job. And so we had to put in those additional stay-at-home measures. We're also asking folks to remember that this week we are not ticketing for street sweeping. Street sweeping citations will not be ticketed, but those begin again. Street sweeping and the enforcement begins again next Monday. Why is that the case? It's the case because if we do not street sweep, 2 things will happen. Number one, we do not clean the gutters and health and safety. We're being told by all of our providers, healthcare folks, firefighters, everyone else, that we must clear trash and debris for health and safety. And if we do not clear all the gutters and the streets, if we have another rain or storm, now we will have flooding. And we cannot deal with both flooding as well as COVID-19 at the same time. So please, the city has made available parking lots across the city, free of charge to go park your car starting next week if you're in an impacted area for parking. So please go to longbeach.gov for all that information. And finally, before I turn this over to Dr. Davis, I want to let everyone that is watching this understand and know that the next few weeks, the next 2, 3, 4 weeks, are the critical weeks in making sure that we're prepared for the hospital and medical emergency that could be in front of us. That means that for every person that gets sick, every person that has to go to the hospital, that's 1 less bed, 1 less ventilator, less masks, less personnel that can help the people that really need help to stay alive during this crisis, not just from COVID-19, but other possible illnesses. So our hospital leaders who I'm talking to regularly are asking you to please stay home, take care of yourself, talk to your doctor, and help our nurses and doctors do the right thing and take care of those that need it. Let's keep our hospitals clear, and please stay home if you can. And with that, I'm going to turn this over to Dr. Davis for an update on the health department side.
Thank you, Mayor. So the contraction of COVID-19 among multiple firefighters highlights the ease with which this virus can spread. As Chief Espino mentioned, the health department is investigating these cases and following up with contacts. We know that this virus is in our community. What's key now is that we take active action, timely and active action to interrupt new infections. That is why we've updated the Safer at Home health order to align with Governor Newsom's executive order that prohibits all gatherings and events, no matter what size. It is truly safer for everyone to be at home to limit exposure to COVID-19, since it's clear that it's spreading in the city and in our region. Again, the order emphasizes the need to stay at home if you're sick. Because most COVID-19 infections are mild to moderate, that sore throat, small cough, or fatigue that you're feeling, which you think could just be a cold, could be COVID-19. So it's more important than ever to stay at home, even if you're in an essential business function, so that you don't pass it on to others, such as healthcare workers or first responders, or those with underlying health conditions. The sacrifices that we make now to lessen transmission will pay off in the long run, with fewer people getting seriously ill and less strain on our hospital systems and our healthcare workforce. Keep washing your hands, keep using hand sanitizer, don't touch your face, keep disinfecting high-touch surfaces in your environment, cover your coughs and sneezes, keep your social distance. We know that you're making a great economic and social sacrifice, and speaking for the city, our healthcare system, and our most vulnerable populations, we thank you. In the midst of this difficult time, try to take time out for your family and yourself. Try to get enough sleep, eat well, find some stress reducers, exercise to an online video, have a silly conversation with your kids, play with your pets, go for a walk if you're able to keep your distance from others, connect with your family and friends by video or phone. I know these things are easier said than done, and this is a time when many of us are facing a lot of anxiety. But it's important in these trying times to try to find some good in every day. Thank you.
Thank you, Dr. Davis. I want to just add, and I think this is really important for folks to know, that I know that things also seem very hard right now, and in many ways, a lot of folks, like Dr. Davis, that have anxiety are suffering from depression. Please, there are obviously a lot of organizations out there that can support you. Our health department, the county has a mental health care line as well. Seek help if you need it, and just know that while this is very hard, I strongly believe, and all of us here strongly believe, that we are going to get through this. We are going to get through this, and on the other end, be stronger for it, and take care of each other. So we will get through this together. We just need to all work together. What we're gonna do now is actually maybe take a couple of the questions and then do the Spanish translation at the end. And so we'll take some questions, and then we're gonna have the message in Spanish for those that might be watching that need Spanish translation. So there's a couple questions, I think, for the fire chief and for Dr. Davis.
Dr. Davis, this is a question from the Long Beach Post. Beyond the 8 positive firefighters, how many police officers or firefighters are currently isolated or quarantined for presumed exposure or while they wait for test results?
So right now I can say that there's a few who are awaiting test results, and the investigation is ongoing. And so we are contacting all of the individuals and tracing their steps and where they've been, and then figuring out who they've had contact with, and then making recommendations based on that.
Thank you. Chief Espino, what kind of strain is this putting on the emergency response system?
So, well, I can tell you that the actual strain as far as an uptick in responses hasn't really been felt. there is a very real strain on both systems, both with PD and fire, in setting up our IMT and our EOC. We have many personnel that are involved with that, and our IMT team actually has a base camp set up at fire department headquarters. But while I'm saying that, I'd also like to point out that it's not only fire and PD that are staffing those positions. All city departments have brought their personnel in to help support this giant operation to protect the city, and I do consider them heroic and coming in. We have sworn members that are coming in, but also we have civilians that are not sworn that are coming in of their own volition. So it's been fantastic to see, and just a great effort by the entire city.
And for those that may not know what the abbreviations stand for, the chief is talking about city teams that we're putting together that are working on this emergency, and it's the different folks from different departments that are at our emergency management center, they're at fire headquarters, and they're working together from different departments to make sure that we're providing the best service and getting the emergency the support it needs.
Fire Chief Espino, from the press telegram, how long before Fire Station 11 comes back online?
We expect Station 11 to be back online by 6 p.m. this evening. I believe the rescue and the engine are currently in service, and the truck should be back in service by 6.
And we do know that there is, right now, of course, we have folks there that are doing a very extensive cleaning and going through to make sure that the actual station is safe, that access to the station in different areas is all being done in a way that is safe for the firefighters and the public. And so that is currently happening right now, but we want to get the station back online as soon as possible. Is that right, Chief?
That's correct.
Okay.
Dr. Davis, also LA County announced it will issue an order today that requires the self-isolation of any person that is tested positive for COVID-19 or is presumed by their physician or clinician to be positive for COVID-19. The order also requires a 14-day quarantine for all close contacts of a confirmed or presumed COVID-19 patient, including household members and caregivers. Does that order apply to Long Beach? If not, is Long Beach issuing a similar order?
So because Long Beach is its own health jurisdiction, we have our own city health department. This LA County Department of Public Health order does not cover the city of Long Beach. Right now, when we do a contact investigation, we verbally give recommendations to both the cases and folks who are exposed. And we don't really do orders unless it's necessary, meaning that they're really high risk and they're not following what we told them. So at this point, I don't see the need to do this order, but it's always a tool in our tool belt if we need to.
And I'll add to Dr. Davis's point also. We've been in communication with the county, so every order that comes out, we try to match up as much as possible with the county and or the state. There are some areas that there are some differences. And so on this specific order that's coming out from the county, while we haven't implemented it this evening or tonight, it is being discussed with our health personnel, with our management personnel, and that could change dependent on some conversations that happened tonight. And so I think it's always moving, but it's not active as of right now.
Fire Chief Espino, has Long Beach changed its 911 response procedures to protect firefighters and paramedics in light of these recent developments?
We have, actually starting with the dispatch center. They are vetting patients' calls more as far as trying to find out whether they have signs and symptoms of the COVID-19. They're relaying that to our fire department personnel that are responding. Also, given the fact that we can get a cell phone number potentially from the patients on the inside, we're calling up prior to arrival, asking them to step outside so we don't have to bring all of our personnel into the home, and that's if they're able. If they're unable, and then we still enter, but that does provide us some safety.
I think we have time for one.
Mayor Garcia, there's some questions that are coming from Facebook, and one of them specifically is, what are you doing about rent?
So from an eviction and economic incentive perspective, a couple things are happening. The first is the City Council just last night adopted an eviction moratorium. It also aligns with a lot what's happening at the state. And so for people that cannot pay their rent, that you cannot be evicted as it relates to financial hardship or any kind of medical hardship. around coronavirus COVID-19. And that's in place through this emergency, whether that's extended, in the months ahead, I think the City Council will look at, but that is in place as well. We also know that just last evening, the Congress passed a package of financial incentives that will go directly to individuals. There's a lot of resources in there for hospitals, for states, but there's also direct resources for residents that they will receive in the form of a cash payment and check. And dependent on your financial status, it depends on how much you'll receive and at what level you are. And so that information we'll be putting that information out in the next couple of days so that people know what to expect. And that will also help them with basic food, utilities, and rent that may be coming down, weeks from now, months from now. But we also want people to know that we're not shutting off anyone's utilities during this crisis. Same goes for other private companies out there. We want to help transition and make sure that people have the resources that they need.
Mayor Garcia, one more question that is coming from those watching us on Facebook Live right now. There is a lot of people that are frustrated and irritated about the parking citations and things that have continued to happen during this time. And there's a question specifically relating to where are people supposed to park when street sweeping citations resume and they're asked to self-quarantine or stay at home and reduce movement and restrict movement?
Well, that's a good question. So the parking question is important for two reasons, like I mentioned before. People need to understand right now that we are not giving citations for street sweeping. We didn't do it last week. We're not doing it this week. If you received one, and there may, of course, in a huge city, there may be an accident and someone gave one, it's not valid. And once you submit it in, you will not be charged for that street sweeping ticket. However, what is still active are other types of citations. For example, if you park in a handicap zone, or if you park in front of a fire hydrant, those citations are in effect. And here's why: because we cannot have someone calling 911 who's having an emergency that needs to get to a hospital and a fire engine or a paramedic not be able to pull up and help that person and save their life. And so we need to have the ability to enforce those types of violations as it relates to parking. But as it relates to street sweeping, because we understand the issue, you will not be ticketed and you do not need to pay. If you want to move your car starting next week, for the reasons I mentioned earlier, because you want to park for free while street sweeping happens, there are lots all up and down the beach, downtown. We're looking at other locations as well where you can move your car and leave it there for the duration of this emergency, so you can move your car if you're in a parking impacted area. The information is at longbeach.gov. There's an email that you can also email when you look it up on that website, and you'll be able to get information about how to do that. So I would encourage folks to park at one of the beach lots, the downtown lots, other lots, and they'll give you a parking permit that is free so that we can get and clean the gutters in front of your homes in the weeks ahead. With that, I want to thank you for this piece. We're going to translate some of this into Spanish so that folks that are Spanish speakers will also get a summarized version of this community update. So let me pass it over. Thank you.
Okay. Muy buenas tardes a todos por acompañarnos hoy. Estamos aquí esta tarde para compartir una noticia importante sobre el estado del COVID-19 en nuestra ciudad. Ayer por la noche recibimos confirmación de que 8 de nuestros propios bomberos de la ciudad de Long Beach recibieron una prueba positiva de COVID-19. Sí me alivia informar que todos permanecen en buen humor y descansan mientras practican cuarentena en sus casas. 4 de los bomberos son residentes de Long Beach, trayendo nuestro número total de casos positivos del COVID-19 en la ciudad de Long Beach a 41. Aunque esta es una situación desafiante durante estos tiempos sin precedentes, quiero asegurarles que el departamento está tomando todas las precauciones necesarias para mantener a los otros bomberos y a las personas con las que interactúan seguros y saludables. Nuestro jefe de bomberos también nos dio más detalles sobre esto, como oyeron en inglés, pero por favor, no podemos enfatizar más que no tengan miedo de llamar a sus primeros respondedores según sea necesario. Ayer lanzamos también otra enmienda enmienda a nuestra orden más segura en el hogar que amplia y aclara disposiciones. Quiero acentuar nuevamente que de los 8 bomberos y también las personas que solamente pueden abandonar su residencia son si tienen una labor esencial, como hemos dicho anteriormente. Las actividades esenciales incluyen cosas como que tienen que hacer, como mantenerse a sí mismo, a su familia y a sus mascotas seguras y saludables, como comprar alimentos o comida o llevar a su mascota a pasear, por ejemplo. Y todo esto lo estamos dándole la información para poder reducir las pruebas positivas y reducir la curva del COVID-19. Además, si está empleado como parte de un negocio o industria esencial, como la asistencia sanitaria o una tienda de combustibles, se le permite viajar desde su hogar al lugar de trabajo. Si es esencial que salga de su casa, por favor, mantenga al menos una distancia de 6 pies de los demás. Evitar tocar objetos y superficies con las manos, tanto como puedas asegurarte de lavarte las manos a fondo con agua y jabón durante al menos 20 segundos antes de tocarse la cara, los ojos y la boca. Si está en una industria esencial y se siente enfermo, por favor, nuevamente quédese en su casa. Este consejo es igual para cualquiera que se siente enfermo, permanecerse en un hogar. Es muy importante que todos nos quedemos en nuestras casas si no nos sentimos bien para salir al trabajo, incluyéndolo a nosotros, los empleados de gobierno, por ejemplo. Ahora, los datos que nos dio el jefe de bomberos, Javier Espino. Como dijo el alcalde Garcia, anoche fuimos notificados que 8 de nuestros bomberos de Long Beach recibieron prueba positiva del virus COVID-19. Quiero asegurarles y tranquilizar a la comunidad que los 8 están en su casa descansando y están en buenos espíritus. El Departamento de Bomberos de Long Beach continúa tomando amplias precauciones para salvaguardar a los compañeros de los primeros respondedores, así como el público con quien interactúan. La investigación preliminar indica que estos bomberos estuvieron expuestos al virus durante el desempeño de sus deberes regulares. El Departamento de Salud y Servicios Humanos de Long Beach está investigando activamente los detalles que se rodean en estos casos, igual como cualquier otras exposiciones potenciales. Estamos trabajando estrechamente con el Departamento de Salud para disminuir más riesgos a otros públicos personal de seguridad. Hemos estado y seguiremos a todos los protocolos establecidos por el administrador de la ciudad, proclamación de esta emergencia local, así como pública orientación sanitaria del Departamento de Salud. Continuaremos brindando el apoyo necesario para nuestro personal y sus familias a medida que avancemos. Trabajaremos a través de estos desafíos. Los esfuerzos de salud pública de la ciudad continuarán enfocándose en contener la propagación del virus y mitigar el impacto de COVID-19 en nuestra comunidad. La ciudad continuará dando prioridad a los adultos mayores y a las personas con condiciones médicas crónicas severas en un esfuerzo para prevenir la propagación del virus y proteger a nuestra mayoría y nuestras poblaciones vulnerables. Mientras que la rectificación del administrador de la ciudad, la proclamación de emergencia local continuará. Proporcionamos la acumulación acelerada de recursos necesarios para librar con éxito esta guerra contra el COVID-19. Me gustaría enfatizar el impacto de la comunidad en la prevención de la propagación de esta enfermedad. No puedo enfatizar lo suficiente lo importante que es para todos en nuestra comunidad para respetar el mandato Safer at Home o más seguro en casa. La probabilidad de muerte todavía sigue que permanece relativamente bajo para la mayoría de las personas. Sin embargo, todos deben tomar precauciones para evitar su propagación a otros. Pueden agarrar más información en nuestra página de ciudad y también les sugerimos que nos sigan a la cuenta @LongBeachCity en su cuenta de Facebook, en su cuenta de Twitter, en su cuenta de Instagram, porque cada de esas páginas tienen mucha información que le puede ayudar a usted y a su familia.
Y muchas gracias también si estás mirando para toda la comunidad. And thanks again. We will conclude this community update and we'll continue to do these in the days ahead. Thank you. Take care of yourself and be healthy.